Okay, welcome to Poop Problems, Solving Encopresis and Chronic Constipation. My name is Stacy Olney. I've started my own company. It's called EllaFay Behavioral Consulting. The reason why I started my own company is because I like to do things a little different from traditional ABA, applied behavior analysis, and maybe have a little more freedom and do more things having to do with public education, hopefully more parent training, and who knows, the sky is the limit. I just felt like I needed to do something different. So here we go. As far as my background, I am a BCBA, that is a board certified behavior analyst. I've been a behavior analyst since 2021. I've been a supervisor since 2005. It's a long time. And I've been working with children since 2003. So here's a little disclaimer about the information presented in this video. The information shared in this webinar is intended for general educational purposes only. It is not a substitute for individualized behavioral or medical advice, diagnosis, or treatment. Because every child's needs and circumstances are unique, please speak with your care providers before implementing any strategies or suggestions from this webinar. Always consult with your child's physician, behavioral health provider, or other qualified professionals regarding any medical or behavioral concerns. Do not delay or disregard seeking professional guidance based on information presented here. EllaFay Behavioral Consulting does not endorse any specific treatment or recommendation discussed in this presentation. The content is intended to support collaboration and informed discussion among medical and behavioral care teams, not to guide individual clinical decision-making. So here's our overview. We're going to be talking about what is encopresis, the signs, the definitions that are related to it, the impact, red flags, myths, why it happens, risk factors, neurodivergence, causes, and the cycle of encopresis. We're going to talk about the path to resolution, that is what physician support looks like, medications, goals, home support, different approaches. We're going to talk about eliminating the crisis of encopresis and how to talk about it with both providers and your children, pairing, protecting dignity, avoiding power struggles, patience and compassion, what parents and professionals need to know. So skill building, collaboration at home and at school, when to seek referrals, and how to be heard. There's a bunch of references at the end of this presentation too, so buckle up because we have a lot of slides. If something happens and I don't get through all the slides in the amount of time provided, what I'll do is I'll stop where we need to stop in time for Q&A, and I'm going to record, afterward, I will record the rest of the slides, and I'll add them to the recording that you'll receive the link to. So you won't miss anything. You'll just have to watch some of it later because I want to respect everybody's time. All right, like I said, buckle up. It's like taking a sip out of a fire hose. This is me, and this is you. Get ready. Okay, so what is encopresis? This is what you see in encopresis. You see very large stools, skid marks, crumbs, or chunks everywhere all the time. The child will hide the evidence of accidents. The child will often smell like poo, and they will deny it. The truth is that they've become nose blind to it. They have a loss of appetite in a lot of cases, especially when they're severely impacted or they're kind of like waiting for a blowout. They will suddenly lose their appetite and won't want to eat. They'll lose interest in exercise. You will see episodic bedwetting that gets worse as they get closer to a blowout. It usually indicates that they're impacted, and the impaction is actually pressing on the bladder. So you'll see an increase in wetting, especially at night for boys. They may actively suppress bowel movements, but most children who suffer from encopresis can't feel when they're having an accident. So they could actively be having an accident and not be able to tell until it's happening. And they certainly can't tell when they need to go, most of them. Most of these kids are triggered by all things poo, and like I said, there's awful blowouts. Some parents mistake the skid marks and the liquid poo that tends to be present Some parents mistake this for diarrhea. So when a doctor tells them they need to take Miralax or laxatives, they're like, what? There's no anything. Please do not treat it like diarrhea. You could actually cause great harm by doing so, if in fact it is encopresis. There was this one story of a kid who he goes to somebody's house, right? I heard this from a friend of mine. This is a real story. He goes to somebody else's house and he stays the night. And then just before bed, he uses the bathroom and he has to leave the bathroom because he's not finding what he needs in there. So he washes his hands, he leaves the bathroom, he goes out to the parents in the house and he says, hey, where's your guy's poop knife? Where's your guy's poop knife? I'm looking for it. I can't find it anywhere. And they're like, what are you talking about? So apparently in his family, everybody has these mega poops that clog the toilet all the time. And so they have a knife that hangs on a chain next to the toilet that they use to cut up the poop. Doesn't everybody have a poop knife? So if you think a poop knife is a good idea, your child may have encopresis. They may have issues with that, or it could be just chronic constipation. So we'll talk about the differences between the two right here in our definitions. So these are the definitions that you need to understand in order to understand encopresis. First of all, we have functional communication, which is difficulty passing stool, and it doesn't seem to have a medical cause, like there's not a disease or something like that that's causing the issue. There's impaction, which is when a hard, dry buildup of feces in the colon cannot be passed. Encopresis is the poop accidents. So it's the uncontrollable leakage of stool outside the rectum due to impaction or long-term functional constipation. Either one can cause that. This can be liquid, skid marks, or chunks, as I said, and withholding. So withholding is active prevention of the passing of stool by the tightening of the sphincter. Now, even though the word here says active, I add the note that it is often unconscious. So there are kids, when they sit on the toilet, they just can't relax. And so that is withholding, right? It's active withholding, but it's also unconscious. So I want to divorce the idea of this being purposeful. In some kids, it is active withholding, like they're on purpose not pooping. But some kids, they can't control it. Sphincters are finicky. Okay, so the anatomy of the colon. Just in case you've never seen it before, we have the cecum, the ascending colon, the transverse colon, the descending colon, the sigmoid colon, and the rectum. So liquid poop starts here. It enters from the small intestine, and then it goes into the large intestine, and it makes its way through the bowel to the rectum. On the way through, the colon is squeezing all of the liquid poo, and it's squeezing the water out of it, right? So it's squeezing all the water out of it. So it starts over here as a liquid, and by the time it gets over here, it's a solid. The longer the poop stays in the rectum, the harder and drier it gets. So if somebody is constipated, as long as that poop is staying in there and not coming out, it's getting drier and harder and drier and harder, because the large intestine just keeps squeezing rhythmically, and it doesn't stop. And as long as it's squeezing, it's sucking the moisture out. This is why stuff like Miralax works for constipation, because Miralax adds more water to feces. So it's harder for the colon to squeeze all of the water out, and it's easier to pass. It stays softer. Okay, impact on kids. Most of the people who are attending this webinar already know about the impact, so I'm going to make this one quick. We have psychological and emotional impact. There's shame, embarrassment, low self-esteem, increased risk of anxiety and depression. Social and peer relationships are greatly impacted. Kids often live in fear of teasing or rejection. They risk isolation, missed school. So many kids either like leaving early or simply not going to school at all. Kiddos that I know who I've worked with Encopresis, none of them liked school. Every single one of them wanted to get out of school at every single opportunity. You end up with lower academic performance. Family life is stressed and strained. And the long-term consequences are risk of chronic bowel issues and lasting emotional impact if untreated. Here's some red flags to look for. This is when it is no longer just encopresis, run-of-the-mill. This is when you notice something. This is when you need to get checked to make sure nothing really bad is happening. So if you see poor growth or weight loss in a child who has chronic constipation, then you definitely want to get that seen. If there's severe abdominal pain or distension, if the shape of the belly changes, also if you can feel a large lump inside the belly, that's the issue too. If there's bloody stools, and not just from wiping, although honestly, I mean, if a kid had bloody stools from wiping, you should probably get that checked because that's not going to help at all. Could be a fissure or something. But if there's bloody stools, if the stool that does come out is black and tarry, that's a bloody stool, and you definitely want to get that looked at. There's vomiting, and vomiting with constipation is a special combination. Neurological signs could include things like leg weakness or tingling or back pain. Urinary issues like frequent urinary tract infections and urinary incontinence. Like I said, usually urinary incontinence alongside encopresis may signal that the impaction is pushing on the bladder. Constipation present from infancy. So if you're dealing with a little kid who's always been constipated, there may be a structural thing or some sort of condition that needs to be diagnosed. If there's no response to standard treatment and there are signs of trauma and distress. So let's take a field trip. We're going to look at some pictures. Brace yourselves, okay? So this is a contrast dye. It's a contrast enema that was given in a physician's office. And then they take an x-ray. The contrast allows the contents of the bowel to be pictured in the x-ray, because normally these don't show up in x-rays, but the contrast dye allows that to happen. And here we see a colon. It doesn't look like our pretty diagram earlier. This colon is full of feces. This child is very, very constipated right here. As you can see, the whole colon is very, very large, right? There's not a lot of room for anything else in there. And then the child evacuated. So here in this picture, this is the same child and they're almost empty. You can actually see the folds of the intestine as they're supposed to look right here. And there's still a little bit in there, so they have some definite impaction, right? That's still there. Now, this next picture, look away if you're squeamish, because this one bothered me so much, but I feel like I have to show it to people. Okay, so this is a 17-year-old with a giant impacted amount of feces in his colon. You can see that the colon is extremely large. And all of this had to be removed surgically. And the reason why I was interested in sharing this photo or during this webinar was because I feel like some doctors tell parents that they're going to grow out of it, and some kids won't grow out of it. Sometimes it just remains a problem. And if it doesn't get treated, then it's going to need to be. Debunking myths. So there's the myth that they're just being lazy. Actually, encopresis is a medical and behavioral condition. It is not willful behavior. Like I said earlier, children lose the ability to feel the urge due to chronic stool retention. It affects the muscles and nerves in a certain way. Encopresis can affect older children even into their teens. Early toilet training cannot prevent encopresis. Constipation, sometimes people think the constipation means no bowel movements. Actually, children with severe constipation can poop daily. The problem is that they're not pooping all of the contents of the bowel. And talking about it will make it worse. Actually, open, shame-free conversations are essential to progress. So now let's talk about why it happens. Here's some risk factors. Family history. So if you have one person with encopresis in your family, you're probably going to have another. I don't think the genetic issues are like spelled out anywhere, but that seems to be a pattern. Emotional and psychological stressors can increase the likelihood of having the issue. Like anxiety can trigger withholding. We have poor diet and low fluids. Hard stools form because there's low fiber and not enough fluid to make elimination possible. Encopresis is associated with neurodivergence, so ASD, ADHD, and other conditions. Lack of support for caregivers can actually be a risk factor for encopresis. So when caregivers are in dire situations and just do not have any support, we tend to see more encopresis. But the number one cause right here is chronic constipation. Chronic constipation is the number one predictor of encopresis because the retention leads to loss of control. Also, toilet training, if it's inconsistent, rushed, or especially if it's punitive, can increase the risk, but also there's medical issues that can increase the risk as well. So the neurodivergent connection, there are higher rates in these conditions. So we have higher rates in ADHD, higher rates in anxiety and mood disorders, higher rates in autism spectrum disorder, higher rates in learning disabilities, and those who have behavioral conditions. So we're talking like OCD and things like that. Some of these are attributed to, for instance, in autism, sensory issues or communication delays or difficulty training children with ASD, where they take longer to learn things. I'm not really sure why it's higher in ADHD. I did read up on it. I can't remember what I read. My apologies. But there are links. If you're very interested in looking that up, or if you'd like to talk to me more about it, I can find that information for you. Root causes of encopresis are, there are various, if you read different things, different people are going to tell you different stuff. Somebody from my background is probably going to tell you it's behavioral. Somebody from a medical background is probably going to tell you it's genetic. A nutritionist will probably tell you it's not eating enough fiber and liquids. So there's a lot of different influences that come together. So biological influences are, basically fecal retention, right? I mean, that makes sense. Possible differences in gut motility or sensation. So some people's guts are just sluggish. I was told by my grandniece's doctor, or at least I heard it from her mom, she was told that her kid pooping every 3 days is actually within the realm of normal. Like I said, a family history, psychological factors, environmental factors, like I said before, punitive toilet training, poor diet, stressful life events. There are a lot of medications that can cause constipation. So if your child is taking any medications at all, you want to read those inserts really carefully and make sure that the medication may not, isn't the cause. There are also allergies and sensitivities that can be seen as present during, present and causing chronic constipation. Even stuff like if somebody's lactose intolerant, which is usually associated with diarrhea, but that can also cause constipation, or it can cause withholding. So let's talk about the cycle of encopresis. So here we have the cycle. It hasn't started yet, but there's going to be an inciting event that's going to kick it all off, and then it's going to be hard to stop. So kid poops one day and they have pain. Who knows why? Maybe they ended up with a fissure. Maybe they got a little tiny bit constipated because of some medication they're taking. Or maybe they've just been really playing hard at the beach for a few days and they didn't drink enough water and they're eating a bunch of candy and they get, a little constipated and then they have a painful poop. And that kiddo keeps trying to poop and it hurts. So they stop. And then we see withholding. Now, withholding is a skill that we want children to have, right? This is the whole point of potty training. It's not to go until the right time, and so kids learn how to hold it. Everyone withholds, This part is not curable, right? It's only resolvable so that it doesn't result in encopresis or impaction or constipation. Many kids will actively withhold. You'll see, like, when really little kids, you'll see grunting or straightening of the legs or hiding. It kind of looks like they're straining to go. It kind of looks like the same. So with like little 2-year-old hides behind the couch and is grunting and straining, and then you check his diaper and there's no poop in there, he's withholding. After a child gets used to withholding, they may continue to do it beyond just convenience, right? So if a kid is playing and having a great time and mom says, do you need to go to the bathroom? And they're like, no, that's usually when you first see withholding. Not necessarily bad, but for some kids it goes over the top, like this kiddo with pain right here. He has pain, and so he is withholding in order to stop the pain. Kids may even also get used to or start to enjoy the sensation of the full bowel. So that may itself be reinforcing. I was reading some Reddit posts from adults who struggled with encopresis into their late teens. And one of them in particular was saying that it was the sensation of withholding that he kept going back to because it actually felt good to him. And so that's why he kept doing it. So then that withholding leads to constipation. Some kids only have a bowel movement every few days that's still in the range of normal, but if it's like every 4, 5, 6 days, it's probably constipation. As the body loses the fight against withholding, this constipation develops. And at first, you didn't want to go, right? And now you can't go. The sensation in the bowel kind of wanes, and then the urge to go changes, and then eventually you don't need to go. And then we see reduced bowel function. Reduced bowel function this little piece here, this gray square, could go pretty much anywhere in this cycle. But it's constipation itself that really starts it. So a kid gets constipated. Now they didn't want to go, and now they can't go, and now that poo is getting harder, and their bowel's been stretched for a really long time, and they start completely losing the sensation to go. Now they don't know that they need to go anymore. And then if this happens over and over and over and over, it actually changes the shape and the function of the wall of the bowel itself and the muscles. So this here is a deflated balloon. This balloon was blown all the way up, and then it was left out. And it started to kind of shrivel over time. And you can see it's stretched out. It's no longer elastic. If you blew it up again, it would probably pop. This is kind of the thing that happens with encopresis. So the bowel expands and it loses its smooth muscle elasticity. And at the same time, it also loses sensation. So kids who we're seeing this cluster of symptoms that includes encopresis, we also see that their bowel is no longer capable of responding like it used to be. So stretches out the bowel, no more elasticity, loses muscle tone and feeling, and it becomes much, much more difficult to pass stool now. Now the constipation is compounded, and the constipation gets worse. And now we see impaction. This is when that stool inside that's trapped in there becomes so hard and so dry it can't be passed. I mean, maybe it could, but it's going to be a very painful process to pass that stool now. So the pattern for recognizing the issue is no bowel movements for a few days or longer, then a string of pee accidents, and then a massive blowout. Now, that doesn't happen for all kiddos, but that's a common course of events. This may also be accompanied by a loss of appetite in the days preceding the blowout. And why do we see pee accidents before a blowout? Remember that it's because the impaction is pressing against the bladder and it crowds out the room to hold pee. So it becomes background noise, and they're now not able to feel anything. It's not that they just can't feel the sensation to go, but they really lose sight of kind of like a lot of bodily sensations as well. You have the crisis. And the crisis is usually the encopresis, usually some sort of awful accident. There's shame. There's emotional pain now. There's embarrassment. We have probably some huge blowout, which is traumatic feeling, because at this point, if they have a blowout now after impaction, at this point, they don't have any control over it at all. And then there's also pain. These are the same color because a lot of times these are the same experience. And then guess what? That results in wanting to withhold even more because poop is now painful and scary. And that's the cycle. So what's the path to ending this cycle? Well, what we need to do is we need to try to eliminate some of these things here. We want to see if we can interrupt this cycle at any one of these points and then keep going until we've got all of the points eliminated. So for instance, let's say you go to the doctor's going to prescribe a clean out. The clean out is designed to hit this one here, impaction, and then end the impaction and then hopefully avoid the crisis, right? The clean out will hopefully also, if the child stays on their medication for an extended period of time, is eating enough fiber and then getting enough liquids and doing some physical activity, you'll see also the threat of constipation will start to go away too. Then the bowel starts to heal itself. Now, the bowel takes a long time to heal, but let's say they're able to do it, and then eventually the bowel function comes back. I'm going to pause for a second because it looks like my video stopped working. Okay, I'm going to keep talking, but I'm going to turn off my video. Okay, so now we need to work on the withholding. Maybe you get some good routines in, some toilet sitting routines, and your child starts to be able to relax and get used to pooping at a certain time every day, and then they stop withholding. And then after that, you eliminate the crisis part of the phase, and there's no more pain. And guess what? The cycle stops, but the cycle will never completely go away. A future without any poop problems is not realistic. Some accidents or brief returns of encopresis and withholding must be expected. You and your child can be empowered to know what to do and take steps that will resolve the problem. So the first steps are physician support. So like I was saying, the clean out. Often this is the first step. The doctor may prescribe oral or rectal laxatives. And then there's going to be maintenance therapy where there's daily stool softeners usually or some kind of laxative. The goal is soft daily bowel movements with no pain. And I have that bolded for a reason. The child has to forget that it ever hurt to poop. They need empty, healed bowels. Now, this means no constipation for 6 months to 1 year. That is a long time, but it is very, very important because if constipation happens again within that time period, they will go right back to impaction because the function of the bowel has not yet been restored. So all of this clean out and this slide just before here, this one, it actually hits all of these points. It should get rid of the pain, the constipation, restore bowel function, and most of all, end that impaction. Medications can be stool softeners, laxatives, or enemas and suppositories. I'm going to hurry through this one. The information on this stuff is pretty easy to find if you Google it. Here's the problem and the goal. Number one, here you have constipation, and here you have recovery. Again, empty bowel for 6 months to a year. Now, really quick, I don't think I addressed it earlier, but I want to address, because of this picture, I want to address why we see that constant leaking of liquid stool or skid marks or chunks. The reason why is because all these super hard pieces of stool here, they've collected in the bowel and they're hard and dry and dry. And do you remember how I said higher up in the colon, there's liquid poop? Now that liquid poop that's higher up in the bowels, it's leaking around the hard mass. It can kind of sift through these little pebbles, kind of like water sifts through gravel, and then it starts leaking out. And because this child now has so much pressure on their rectum and they also can't feel anything, they have no control over this leakage. So the next steps after you see your physician is home support. And usually the prescription is scheduled toileting, regular sit times, usually after meals, which supports the body's natural reflexes. We also have nutrition and fluids, right? So fiber-rich foods and water, which reduces the recurrence of constipation. Monitoring and follow-up. So you should probably be tracking your child's bowel movements, any side effects you're having from their medications, and their progress, and adjusting the plan as needed with your physician over time. Also, it is important that they get daily movement and exercise. Whoops, I just crossed that out. Daily movement and exercise. The best one I found for kiddos is jumping. If you can get them to jump on a trampoline, I swear they cannot hold the poop in anymore. Also, like encourage activity like walking. Walking is probably one of the best ones, but anything that involves full body motion. So now that we have, eliminated the withholding and the constipation, the impaction, we're working on getting rid of this reduced bowel function. How do we fix this? We're going to talk about that in a moment. But first, here's a great guide. So you're going to get the slides. You're going to be able to click on this link right here. You can also Google this guide for managing constipation in children. I love this guide. I think it's amazing. I'm going to scribble all over it because I think you should download it. It's a PDF available for free online, and it's kind of like a little workbook for parents, and it's got a lot of good answers in it. So much better than I can do in a webinar. Non-medical approaches will include nutritional interventions, microbiome-based options, behavioral strategies, and physical and manipulative therapies. I am going to quickly show you a few of these. So, of course, we have fiber and fluids, right, which we've talked about. But then you could try an elimination diet. So sometimes a cow's milk allergy can contribute to functional constipation. 80% of kids improved with a dairy-free diet. And other allergies and sensitivities should be ruled out. We have probiotics and prebiotics, and then symbiotics, which apparently combines both. There is evidence that they can help, but they're well tolerated and they're generally very safe, so that's why people try them. Some studies say that they're great, some studies say that they're whatever. It's probably doesn't hurt to try. There's botanicals and natural laxatives like senna. Some people say that senna is irritating. Then you have stuff like aloe vera and these kinds of things to avoid or use with caution. I have had, in talking to different parents, I had some parents say olive oil helped their kids. They literally just gave them like 2 tablespoons of olive oil a day. I don't know. You're going to have to talk to your physician about it. And then another parent that I talked to used mineral oil. She said it helped because her child absolutely couldn't hold on to the poo, and she was able to keep her cleared out. She would literally mix it into a Hershey's syrup bottle and squirt it into her daughter's mouth, which her daughter was so excited to do that it worked. So I'm not recommending that. I'm saying, talk to your physician. So behavioral strategies. Behavioral strategies can address withholding and anxiety. right? Painful stools equal fear. And you can address the stool withholding with this. CBT is something I would recommend. Play therapy is actually I don't know a lot about it myself, but it is an evidence-based practice. Toilet confidence is key because you got to end the crisis and you got to help them relax. You can't poo if you can't relax. Scheduled toilet sitting, like I said, reward systems, posture and breathing is often recommended as well. Pelvic floor therapy is one that was in a study, and biofeedback. So these are also things you can ask your physician about. Breathing and massage may help. And acupuncture, believe it or not, I was amazed to see it in the study. Early studies show promise in kids. Interesting, but there are sham acupuncture clinics out there, so watch out. So why go to the doctor? Because I said so. You have to go to the doctor. There is no getting around it. If you are a family and whose child is experiencing encopresis and has not seen a doctor or hasn't seen a doctor in a long time, please find a way to make it happen. It's important to identify any medical causes of constipation or soiling. You have to rule out red flags. It can help to create a treatment plan. And most importantly, you need to go to the doctor to know how bad the encopresis is, because your child is not going to be able to tell you how bad their impaction is. And you need to know if they're cleaned out, if they're not cleaned out. You need to know if the impaction is pressing against their spine. You need to know these things. How impacted are they? At a doctor appointment, the doctor will ask you questions about your child's bowel habits, diet, stress, and toilet routines. They will give a physical exam, including abdominal and possibly a rectal exam. This exam, unfortunately, usually involves the doctor sticking their finger up their butt. Oh, poor kids. Sticking their finger up there because they need to see what the impaction is like. And they also palpate the edges of the wall of the colon because they're assessing the muscle tone. Possible imaging like X-ray to check for stool buildup. Again, that will tell you how bad it is, like our pictures, and discussion of treatment options. Now, one thing you need to know is that you can ask all kinds of questions of your doctor, and you can ask for changes in medication. Some doctors will prescribe laxatives, and then parents are pulling their hair out because the laxative caused the child to have a poop accident at school every day, and they can't just keep doing that. But you can ask for the medications to be changed or medications to be specially timed. What you need to know as a parent is bring your notes on your child's symptoms. Please take notes, put it in a little notebook, keep it in your pocket, something. It's okay to ask for non-medication options. You have the freedom to discuss whatever you want with your physician. And your child may feel very embarrassed. Make sure you take the time to reassure them and ask for sensitivity from the provider. You can also request to speak to the doctor alone because some kids can't handle being a part of these conversations. Now, here's a real question. What if your child just can't? What if they just can't? What do you do? I mean, I know parents who are told by a doctor to increase the fiber in their child's diet, but this results in a 45-minute tantrum that's red-faced and screaming. That child just can't. Here are my tips that can potentially work for any situation. This is a mindset that I want you to put on when you encounter the fact that your child just can't do something they have to do to manage their encopresis and to resolve their issues. Number one, you need to start small. Big problems feel less overwhelming when we zoom in. Look for the first reinforceable behavior. Did they tell you they had an accident? That's a start. You want to reward their effort, not the outcome. Thanks for coming to the bathroom with me. Right? That's an easy, small little thing that you can reward. Maybe they didn't stay in the bathroom. That doesn't matter. Progress starts with what's possible today. And that brings us to our next one, We want to stay positive, right? Like I said, rewarding the little small efforts, not necessarily the outcome. Kids grow fastest in safe, encouraging environments. You want to catch them being good as often as possible on purpose. So you want to be looking for when they did the teeny tiny little things well, right? Even small efforts deserve praise. Frame contingencies as rewards instead of consequences. I mean, you could say, you can have this thing that you're looking forward to when you've done this. Or you could say, if you don't do this, you can't have that. The former is way more positive and easier to swallow. So try to frame your contingencies as rewards. Also, positive attention from you is the most powerful reinforcement that I know of. Kids want to be loved by their parents. Think in steps. So this isn't going to be solved in a day. It's not going to be solved in a week. It's not going to be solved in probably months. So you want to be thinking long term. Break your goals into doable chunks. So let's say in the first week, they flush. And the next week, maybe you'll work on wiping. And then later, they can clean the toilet. You want to celebrate each new step before expecting the next. Don't expect too much. Just focus on the one small thing you're trying to get them to do today. Increase your expectations as skills grow and not before. And work on one chunk at a time until that chunk of the plan is mastered. So I'm going to try to make you memorize this, all right? So let's go. What is our first one? Start small. Start small. What's the next one? Think. Oh, wait, nope, that's not it. Start small. Stay positive. And the next one is think in steps. So small, positive steps. What are they? I won't make you say it. It's cool. We want to think in small, positive steps. Yay! How do we end the crisis? Well, this is the hardest part. This is kind of the emotional part right here. After your kid has developed an intolerance and everything poo is triggering, how do you stop that from being triggering? Well, you can start anywhere in the cycle. You know what? I'm going to skip this slide. Never mind. Okay, a concept from ABA that has to do with all of this. The following is not meant to be a trick, but rather a new way of thinking about behavior that you can use to your child's advantage. Also will help you understand the problem better. So pairing is a very important concept from ABA. Like, I used to love this one air freshener. I thought it was amazing, but now I hate it. Why? Because it's been paired with the smell of poo. Now, every time I smell that air freshener, I think of poo. And now I hate that air freshener. That's pairing. One thing that was fine is now not fine because it has been paired with something that was not fine. Like, here's something from a different direction, right? I love the smell of cigars. Why do I love the smell of cigars? Yes, they're stinky. Yes, it doesn't make sense. But I love the smell of cigars because it's paired with my dad. My dad smokes cigars every once in a while. So when I smell one, I think of him. And that's a good thing. And so that has been paired. Now something that icky is now good. In Encopresis, it shows up like a child is avoiding poop because it's been paired with pain, right? So they're doing that withholding. They're trying to escape from it. The bathroom becomes scary because it's paired with stress or frustration or blowouts, that kind of thing. You can use pairing to your advantage by pairing good things with the poo problem, with the part of the cycle that you're trying to interrupt, or with something that you want them to do. In ABA, we teach our therapists to work at pairing themselves with our learners' favorite things so that they become a favorite person. All they have to do is hang out when the kiddo is having lots of fun. How? How do you do it? You can use humor, silliness, smiles, hugs. I'm going to turn on my camera again. Hopefully it's working this time. Hello. Okay. Fixie. There we go. Yay. All right. So humor, silliness, smiles, hugs, books, toys, screen time. You can make the bathroom into a magical realm filled with elves and trolls, or you can just give them attention and some knock-knock jokes. It depends on what your child likes, what makes them happy. So go all in and make sure that they actually like it. If they lose interest quickly, invest less time in each special thing and plan to change things up a lot. So tips on timing is really important here. Like if you want them to love the bathroom when they hate it, or if you want them to love cleaning up their messes when they hate it, it's going to be a long battle, but you can work on making it feel better, right? First of all, you want to start the fun thing that you're trying to use to make things nicer after the hard part begins. And you want to keep it going during the activity. For instance, you play their favorite song while they sit on the toilet, but you get them to sit on the toilet first. Then you play their favorite song. Start the hard part, then introduce the nice thing, and then let that nice thing continue throughout the process. So use humor, music, toys, bubbles. You know, the thing is you got to really make sure that your kiddo likes the thing. I mean, I've had a bunch of kids who, you know, said that they like stickers, but every time I tried to reward them with stickers, they like hated it. And I was like, well, obviously you don't like stickers. So you got to be really careful about what you pick. Every kiddo is different. And here's a precaution. Don't let your happy pairing go south. Repeated association of a favorite thing with an unpleasant thing can go the other way. And you want to rotate your stuff before it happens. Give your child lots of different choices, and that will teach you what they like. Please do not use purposeful pairing with punishment. Don't try to make things that they're doing that they like doing, like sour, by pairing it with bad things. I'm going to tell you this is going to result in negative side effects like avoidance, emotional outbursts, and sneaky behavior. So how do you talk about it with your kiddos? One thing you want to do, speak privately, right? Do not speak about their accidents or their poo problems in front of siblings or peers or other family members or people from outside the house, unless you have asked them if they're okay with those other people being involved in the conversation. You want to use calm and respectful language. Focus on solutions, not blame. And involve the child in as many small decisions as possible regarding their care. And again, praise effort, not just outcomes. This can be a really hard lesson for parents to learn because obviously when we start out with little kids, they have no dignity and they need no dignity. You know, like a 2-year-old has no dignity, right? They get their butt changed and then they're off. They probably don't even care if they're wearing a diaper. You know, there's no dignity. But as children get older, dignity matters more and more and more, and some parents adapt to that very slowly. You want to avoid using shaming words like disgusting or lazy or babyish or anything of the nature, or any triggers that your kids have. You want to avoid public comments, avoid visible frustration. I know that's really hard, but you got to get that good poker face going. And you want to avoid talking about the issue like it defines who they are. And especially, you want to avoid talking about it in front of them as though they are not there. Avoid power struggles. Fights over cleanup are super common. The basic advice is offer choices. Stay neutral. Use a calm voice. No threats, no shame. Use first then, like first we finish cleaning up and then you can watch your show. And validate their feelings without giving in. But here's my perspective on power struggles. I have so much to say on avoiding power struggles. I really think I'm going to have to make this into a new webinar. My first job out of college was working with a large group home with seriously emotionally disturbed teenage girls. And many of them were physically aggressive. And I learned really, really fast that you cannot make anybody do something that they don't want to do. As children get bigger, the illusion of caregiver control evaporates, and then you have to make them want to do the thing that you're trying to get them to do. You want to reserve the right to reschedule the fight. If you're triggered, if you're losing your mind with this kid, if you've had it, just end the struggle by walking away, at least for a little bit. You can regroup and figure out how to get calm if you just take a minute. This may look like apologizing to your kid because you said something you shouldn't. It may look like taking a break. It may look like giving in, but I am telling you that giving in is better than the nasty fallout of losing your temper or starting an unwinnable war. Next, don't negotiate with terrorists. Forgive my joke. If a child is shouting, making unreasonable demands, or literally fighting you, all these things, do not haggle. This only gets worse over time if negotiation happens while they're fighting you. You want to stand your ground, but also choose which hill you die on, right? You can't die on every hill. You're only going to be able to die on a couple. So that means figure out the things that are the very, very most important, the most important things that you're going to stand your ground on. And you have to do this. I'm not going to budge. But the other things, figure out a way to make them negotiable. And it will improve your mental health because you only have to die on a couple hills, not every one. And remember that learning is like pooping. You have to be relaxed for it to happen, right? So if somebody's mad, if somebody's red-faced, if somebody is stuck and they can't see or think clearly because they're upset or they're sad or something, you have to wait and do the learning stuff and the teaching until later, until they're relaxed. So you can save the lessons for later. Also, make sure you post the speed limit. Post the speed limit means making sure that the rules are really, really clear and that they're visible. They're somewhere in the house where everyone can refer to them, or maybe multiple places. If your child doesn't read, I suggest using pictures. And then, of course, there's advice for doing that that's easily available online, or you can talk to me more later. You got to have patience and compassion in order to build trust. Expect slow progress. Stay curious instead of frustrated, right? Find out what is making this hard today. Try to be an investigator. Separate the child from their behavior and recognize how hard they may be trying, even if you can't see it. Remember that it isn't your fault and it isn't their fault. And shame is pain, but compassion creates safety. So, skill building. I see that it's 8. I think I'm going to go on for 5 to 7 more minutes, and then we'll do Q&A. So, skill building, the basics. Breaking tasks into small steps, using visual supports or checklists. Actually, you know what I'm going to do really quick? I'm going to turn on our questions. So if you have had a question that came up, you can go ahead and ask the question at the link above. So break things into small steps. I mentioned that a little bit before. Use visual supports or checklists. Practice skills outside moments of stress. That's a little bit redundant, but it really deserves repeating. And allow privacy where it's appropriate. You can level up by using shared responsibility and fading yourself out. So gradually giving them a little bit more and more responsibility over pieces of the process, like their routines or the responsibilities of cleanup. Use routines that build confidence by keeping things as the same as possible every single day. Keep cleanup tools visible and accessible as much as possible. Make sure that they're child-friendly so that your kid can easily start to participate on their own. You can use timers and gentle reminders. And again, celebrate private victories. The biggest tip is to teach them how to use language for self-advocacy and ask for what they need instead of struggling for what they need. Practice prompt them to use scripts like, I need to go, can I have my privacy, I need new clothes. This is especially important for kiddos with autism. Now, what do parents and professionals need to know? Kids often avoid help out of shame, fear, or past negative experiences. So, children who are suffering with this may not be able to ask for help. In fact, in the very situations when they need the most help, they may clam up or freeze. Well-meaning adults may miss these signs or mistake this occurrence for behavior problems. So, you want to coordinate clear communication. Focus on dignity, consistency, and again, focus on small progress. If your child is going to school, you'll need to make a plan with them. You should ask if there's a toileting or bathroom plan already in place. By the way, at the bottom it says, include this in a 504 plan or an IEP plan if possible. That's probably your best bet as far as making sure that the school follows through, especially in IEP. Use private, respectful language when talking to staff, because those staff are going to pick up on however it is that you're speaking about it. The staff and the teachers are going to follow your lead when they talk about it. So if you're using respectful and careful language, they will as well. Request non-punitive cleanup and support. And create a plan like spare clothes and supplies, having a cleanup space, how and when the child can signal the need for help, and who is going to help them if they need it. When you're talking with friends and family members, you want to choose what to share based on your child's privacy, their age range, and their relationship with the family member. But let the family know what helps and what doesn't. You might ask them, please don't comment on smells or accidents. Or you might say, hey, we have a secret word and you're allowed to use it. This is what it is. You want to ask maybe, please give them privacy, stay calm, don't get upset with them, call me. Be clear with them that this is a support issue, not a discipline issue. And punitive measures are really, really, really going to make the problem worse, and I can't repeat that often enough. Sometimes it's easier said than done here with family, especially where social hierarchies are involved, like grandparents, like who tells their parents what to do. That's real hard. I suggest looping in another provider like your BCBA if you have one when you can, or providing an authoritative source of information for them. Like, for instance, having them watch a piece of the webinar or something like that, like, hey, this lady says do that. Then it's not you telling them, it's this lady telling them. Working with service providers, you want to make sure you share your full story. You want to use really strong language with your service providers. A lot of people don't use strong enough language because they're afraid. Some people are afraid of admitting how bad it is. Some people are triggered themselves and don't really want to think or talk about how bad it is. But if you aren't very, very vocal with your service providers, you're not going to get good care. Nobody else can understand how hard it is and what the problem is that you're looking at besides you. And most people learn how to downplay these things in order to cope. When you see your service provider and when you're talking about it, that is not the time to cope. That is the time to just let everything like spill out and tell them all the details. You want to ask for help with building healthy routines. You can make behavior plans for cleanup or hygiene or toilet sitting, depending on what works for your family and what exactly you're ready to work on. You can ask for parent coaching and help with emotional regulation. You want to combine behavioral and medical care. It's not like either or, they go together. And you want to ask providers to respect your child's privacy when they talk about it. When to seek referrals. So this is both for parents and professionals, right? When do you need to seek somebody outside of your current care circle? When there's severe constipation or medical complications. If your child is over 4 and still not toileting consistently, you probably want to rope somebody in. If there's persistent refusal to sit, clean up, or engage in care. If you observe regression or emotional shutdown that wasn't there before. If there are signs of trauma, a sensory phobia, or signs of OCD. If you and your child feel stuck or overwhelmed or exhausted or like you just can't do it anymore, you definitely want to seek some extra help. This might be a pediatric gastroenterologist. It might be a developmental pediatrician. It might be a behavior therapist / BCBA, the ABA route. It might be an occupational therapist. It might be a child psychologist, or all of these. So when you go to see your provider, how do you make sure that that provider is going to hear you? This could be a physician. It could be a behavioral health provider, like a therapist. It could be, it could be like a BCBA you're working with or something like that. How do you make sure that you're going to be heard by them? A lot of times these providers are gatekeepers for services. You have to talk to them, and they have to be convinced that you need a thing in order for you to get it. So there are some important points to communicate, right? You want to make sure that when you talk to this provider that you're being specific. So provide clear examples of the behaviors or issues that you're observing. This helps the professional understand the whole context better. You also want to emphasize the impact that it's having on you and your child and your family. Explain how these challenges affect your child's daily life, their development, their chances and opportunities to participate in the same things that their peers are, and try to make it relatable and understandable. You want to share information from multiple sources. So if you have any quotes or any reports from a teacher or a therapist or other caregivers, mention that as it gives a well-rounded picture of your child's needs. So for instance, if grandma says, oh yeah, when I'm watching him, let's say he has an accident like every single day that I come over to watch him, you definitely want to include that in the report, because then it's not just you saying it. You want to use goal-oriented language. So discuss what outcomes you're hoping to achieve, right? Through obtaining services or a diagnosis or help in a certain area, like Encopresis. I just want my child to be able to, go to school without missing any more days. Or I just want my child to be able to have one day where he doesn't smell like poop. Something like that. Or you could say, I want my child to be able to use the bathroom normally or finally be potty trained. You could put it like that too. You want to show a willingness to collaborate. So sometimes when stressed out parents are talking to gatekeeper professionals, they can, especially if they haven't been listened to in the past, sometimes they can come off as a little forward or a little strong or maybe a little too stern. So you want to make sure that your tone expresses a desire to work together with a professional for your child's best outcomes. So this opens the door for constructive language. So I suggest that if you're looking forward to a conversation with a physician or a different kind of gatekeeper provider, I would say have a practice conversation in the mirror or your phone. Your phone is best. Record it and then think about your communication. Evaluate yourself. Did I use specific examples? Did I make the impact on my child and my family clear? Do my examples show a pattern? Have I stated my goals? Am I open to collaborate? If your physician or the provider doesn't seem to want to hear your story or your example, or is like, oh, okay, I got it, and is moving on, you want to practice this in the mirror too, right? If you think that your provider is going to do that, you want to practice saying, excuse me, I feel like this is really important and I want to make sure that I'm heard because we've been struggling with this so much. Would you mind letting me talk a little longer? Can we talk some more? Can we schedule another appointment? Anything to get them to hear you. And here is another thing. If your physician or that provider is simply not listening to you, I would suggest getting a new one as fast as possible too. Don't stick with somebody who's not helping you, especially if you're paying the money. If you're paying somebody money, you deserve to have good care. So, my services and free consultations. I do ABA. ABA is the science of behavior. We help with skills, communication, daily living. ABA stands for Applied Behavior Analysis. So it happens in schools, it happens at home, it happens in clinics, it happens out in the community. My work as a BCBA, like I was saying earlier, started in 2021. I've been doing ABA since 2017. I work at a small ABA company in Riverside County. I think it's Riverside County. It might be San Bernardino now that I think about it. Anyway, that's where I work. And I also have newly launched EllaFay.org. I specialize in parent coaching and IEP advocacy. I also do trainings and personalized help for providers. So I just want to note that although I do IEP advocacy, but IEP advocacy, okay, let me go back. Let me say that again. My IEP advocacy work is not covered by my BCBA credential. It's a separate thing from my behavior analytic work. So I offer private pay services. Right now, I do not work with insurance, and I may not end up working with insurance. I also do study groups for the BCBA exam. So if you know somebody who wants to become a BCBA, they can attend one of my free study groups. I don't charge for students. We just have a great time and we learn a lot of cool sciencey behavior stuff together. You can find my website on this QR code or at EllaFay.org. That's EllaFay.org. You can schedule a free 60-minute consultation. I'm also on X, and I'm on LinkedIn, and I'm on Facebook, and I'm on Instagram, and I'm on YouTube. Now, right now, I only have one video that's public on YouTube. The rest of my videos are currently unlisted. If there's a topic that you'd like to see in a webinar or a video, please just send me a line and let me know, and I'll plan it. I gotta say, it is so hard to tell jokes when my audience's microphones was off. It's a dead house, man. I love you all. Excuse me.